Well, you know what? As we get older, our teeth are always changing. Sometimes they move around a little bit too, with spaces where there weren't spaces before. There's a place you can go to put a smile on your face, not only for today, but for years to come. Here we are once again in the offices of Dr. Stephen Marsh. And doctor, we're going to talk today about maturing and how teeth can shift over the years.
Well, there are a lot of things that happen when we mature, as you may know.
Yes, I do know.
So sometimes people wear their teeth down. That's called bruxism. Sometimes they're grinders. Sometimes people have had orthodontics as a child or even as an adult today. And if they don't wear the retainers, Joe, the teeth will move. And we try and tell everybody that.
Yeah,
but
so true.
It's hard to get people to be compliant, especially men, if you will.
Well, and you say that because it's a good point. Most men don't follow through. Women are a little bit better at that than doing that. But truthfully, we can't go back in time. We can't go back and find that retainer that we put in our top drawer decades ago, but we can get the smile that we've always deserved and we had maybe years ago. You can make that smile return.
Well, in most cases we can.
Right.
And we do that with cosmetic dentistry, sometimes bonding, reshaping, and porcelain veneers and crowns. And I think today we'll look at some of the patients we've helped.
I understand there's some dramatic transformations ahead of us here. Who are we going to start with?
Thanks, and they are in fact dramatic. So our first patient's Kelsey, and Kelsey's actually a helicopter pilot. And she didn't like the way her teeth looked. She had very small laterals. Those are the teeth next to the fronts. Those are called centrals. And sometimes those laterals don't even develop. It's a pretty interesting thing in dentistry. But she really wanted a beautiful smile. She didn't have a lot of time. She actually had about a week and a half for us to do the work.
Oh, my.
She came in for us to do that. We reshaped the lower teeth. And in the uppers, Joe, we did 4 porcelain veneers and gave her a smile that she said for the first time in many years she's comfortable, and she'd go up in the air with a beautiful smile.
There you go, yeah.
So Spencer was an interesting young man. He was in graduate school, and he had seen an orthodontist, and I actually had the opportunity when he was younger to work with the orthodontist. And though the teeth looked well spaced, we actually did that on purpose to create space in an idealized way so that we could do the work. And he was missing that lateral that I talked about on Kelsey.
Born with it.
Wasn't born with it.
Okay.
So we actually did 10 porcelain veneers. We raised the tissue using a laser. And you can see it's a smile that he's proud of, and now he's actually graduated recently, and he said, you know, he has a smile that everybody wants, and he was someone who was ashamed to smile as a kid, as you can imagine. So let's talk about Connie. Okay. So Connie had a space between her upper front teeth. She said it was a characteristic of most of her family. She was in her 50s. She said she had wanted it closed for a long time. She was able to come in and see us. And she also had some crown work that wasn't up to the way she wanted them. That's probably the best way I can say it.
Okay.
So we raised the tissue again using that laser, and we wanted things to be symmetrical, so we reshaped the teeth and gave her the smile that she said she's always wanted, and she was thrilled and has become a wonderful patient. And lastly, the most dramatic one, and this is Ray. So Ray was a mom, took care of her 3 kids. They all went through braces. She never had enough space in her own mouth to make things look normal and natural. So we talked about different options. She wasn't ready to go through braces. She had already done it twice. It didn't work out well.
It did not work out.
Did not, and as you said, they shifted over time. So we actually reshaped the teeth. We narrowed those front teeth, and we did porcelain veneers. We did 6 teeth to give her a beautiful smile. And actually, Joe, when she looked in the mirror, I can tell you she actually cried. She almost wept and said, I've been waiting for this for the last 20 or 30 years. So gratifying for us and much gave her a lot of pleasure.
Well, I'll tell you, the transformations are incredible. And if you want to see a transformation in your own life, maybe you had straight teeth years ago and maybe you never did, Dr. Marsh and his team can make those dreams come true, really. You can wake up to beautiful smiles each and every day. So simply call the number 440-461-1003, 440-461-1003, or you can log on to the website clevelandsmiles.com. Doctor, thank you so much.
It's my pleasure.